The retina is a light-sensitive membrane in the rear of the eye that detects light. The lens concentrates an image on your retina when light passes through your eye. The image is converted by the retina into signals, which are sent to your brain via the optic nerve. To create proper vision, the retina collaborates with the cornea, lens, and other elements of your eye and brain. When the retina separates from the back of your eye, this is known as retinal detachment. Depending on how much of the retina is detached, this results in partial or total visual loss. Your retina cells may be severely deprived of oxygen if it becomes detachment. If you notice any abrupt changes in your vision, contact your doctor straight once. If a retinal detachment is left undiagnosed or corrected too late, it might result in permanent visual loss. Although there is no pain associated with retinal detachment, there are frequently indications prior to the detachment. The following are the most common symptoms: blurred vision, partial vision loss, sudden flashes of light when looking to the side, suddenly seeing a lot of floaters. Types and causes of retinal detachment. Seeing a lot of floaters. Types and causes of retinal detachment. There are 3 types of retinal detachment: Rheumatogenous, tractional, exudative. Rheumatogenous retinal detachment. You have a tear or hole in your retina if you have a rheumatogenous retinal detachment. Fluid from inside your eye can now pass through the hole and behind your retina. The fluid separates the retina from the retinal pigment epithelium, the membrane that supplies nourishment and oxygen to your retina, causing the retina to detach. The most common type of retinal detachment is this: retinal detachment due to traction. When scar tissue on the retina's surface tightens, your retina pulls away from the rear of your eye, causing tractional retinal detachment. This is a less prevalent sort of detachment that usually affects persons who have diabetes. Diabetes mellitus that is not well controlled can cause problems with the retinal vascular system, and this vascular damage can lead to scar tissue accumulation in the eye, which can lead to retinal detachment. Exudative detachment is a state of being detached from one's own body. There are no tears or breaks in your retina when you have exudative detachment. This form of detachment is caused by retinal disorders such as the ones listed below. An inflammatory condition that causes fluid to build up behind your retina. A tumor behind the retina. Coates disease, which is characterized by improper blood vessel formation, resulting in the leakage of proteins that accumulate behind your retina. When it comes to retinal detachment, who is at risk? The following are some of the risk factors for retinal detachment. Extreme nearsightedness, which puts extra strain on the eye. A family history of retinal detachment. Damage to the eye. Being over 50 years old. Prior history of retinal detachment. Complications after cataract surgery. Diabetic mellitus. Retinal detachment diagnosis. A complete eye exam will be performed by your doctor to determine retinal detachment. They'll examine your vision, your eye pressure, your eye's physical appearance, your ability to discern colors. Your retina's ability to deliver impulses to your brain may also be tested by your doctor. They may examine the blood flow in your eye, particularly in your retina. An ultrasound of your eye may also be ordered by your doctor. This is a painless test that creates a picture of your eye using sound waves. Retinal detachment treatment. The majority of the time, Surgery is required to reattach a detached retina. A simple procedure can be performed in your doctor's office for mild retinal detachments or tears. Photocoagulation. If your retina has a hole or tear but is still attached, your doctor may use a laser to conduct a surgery called photocoagulation. The laser burns around the tear site, damaging your retina and attaching it to the back of your eye. Cryopexy. Cryopexy, or freezing with extreme cold, is another possibility. Your doctor will use a freezing probe outside of your eye in the area over the retinal tear site for this therapy, and the scarring that results will help keep your retina in place. Retinopexy. Pneumatic retinopexy is a third treatment for small detachments. Your doctor will implant a gas bubble in your eye during this treatment to assist your retina in moving back into place against the eye's wall. Your doctor will use a laser or a freezing probe to seal the holes once your retina is back in place. Scleral buckling. Eye surgery in a hospital is required for more serious detachments. Scleral buckling may be recommended by your doctor. This includes wrapping a band around the exterior of your eye to push the eye's wall into your retina, allowing it to heal properly. Scleral buckling can be used with vitrectomy surgery. During the scleral buckle surgery, cryopexy or retinopexy is performed. Vitrectomy. Vitrectomy, which is done for bigger tears, is another alternative. This surgery is usually done as an outpatient procedure, however it may necessitate an overnight stay in the hospital. Your doctor will use small instruments to remove aberrant vascular or scar tissue from your retina, as well as vitreous, a gel-like fluid. Then they'll use a gas bubble to restore your retina back in its right position. During the vitrectomy procedure, cryopexy or retinopexy is performed. This small information may help to you understand about retina detachment. If you like the video, please like, share, subscribe and press bell so that you can get my regular upcoming videos. If you want any information of any subject, write the subject in the comment box.